If you are on Medicare and still paying full price for your prescriptions, stop. There are 5 legal programs that reduce or eliminate your drug costs completely. And most seniors have never been told they exist. The Social Security Administration estimates that extra help alone is worth $5,700 per year. Millions of eligible Americans have never applied. Here is exactly what you are owed. Before the 5 programs, one number you need to know. Around 90% of all Medicare beneficiaries who qualify for prescription drug assistance are not receiving it. Not because the programs are difficult to access, because nobody told them to look. The drug coverage system in America is deliberately complex. The pharmaceutical industry and insurance companies have no financial incentive to simplify it. The result is that seniors on fixed incomes, managing multiple chronic conditions, often pay hundreds or thousands of dollars per year for medications they could receive at dramatically reduced cost, or for free if they knew where to apply. The Inflation Reduction Act of 2022 changed the Medicare drug coverage landscape more significantly than any legislation in decades. Most seniors have heard nothing about it. The changes took effect in 2025 and 2026, and they are substantial. Here is what they mean for you. Number 1, Medicare Extra Help, also called the Low-Income Subsidy. This program is estimated by the Social Security Administration to be worth $5,700 per year for the average qualifying senior. In 2026, the program is worth approximately $6,200 annually, according to Humana's analysis. Extra Help is available to Medicare beneficiaries with limited income and resources. In 2026, it is available to people with income up to 150% of the federal poverty guidelines. For a single person, that is $23,475 per year. For a married couple, $31,725. Your home does not count as a resource. Your car does not count as a resource. In 2026, the resource limit is $18,090 for a single person and $36,100 for a married couple. Money in checking and savings accounts, stocks, and bonds count toward this limit, but burial expenses up to $1,500 per person are excluded. Many seniors assume they will not qualify because of savings, but the limits are considerably more generous than most people expect. The Social Security Administration says, "Always apply and let us decide. With Extra Help, your Part D deductible is waived. Your plan premium may be waived. In 2026, you pay no more than $12.65 for each brand name drug. Your plan covers and $5.10 for generic drugs. Once your total out-of-pocket costs reach $2,100, you pay nothing for covered drugs for the rest of the year. If you also have full Medicaid and are enrolled in the Qualified Medicare Beneficiary Program, you pay no more than $4.90 per prescription. Apply at ssa.gov/extrahelp or by calling Social Security at 1-800-772-1213. The application takes approximately 20 minutes. There is no charge. If you qualify, the benefit applies retroactively to the month you applied. CMS estimates that between 2 and 3 million Medicare beneficiaries who qualify for Extra Help are not currently enrolled. If you have not applied and your income falls below 150% of the federal poverty level, apply today. Number 2, Medicare Part D Out-of-Pocket SAVE, $2,100 in 2026. This one was created by the Inflation Reduction Act, and most seniors on Medicare do not know it exists. Before 2025, Medicare Part D had no limit on what you could spend on prescriptions in a single year. People with cancer, diabetes, rheumatoid arthritis, and other serious conditions sometimes paid $8,000 or more per year, even after reaching what was called catastrophic coverage. There was no ceiling, there was no protection. The Inflation Reduction Act changed that. Starting in 2025, there is a $2,000 annual out-of-pocket cap on Medicare Part D prescription drug costs. In 2026, that cap adjusts to $2,100. Once you hit that amount in a calendar year, you pay $0 for covered drugs for the rest of the year. The coverage gap, previously called the donut hole, a period where Medicare drug coverage dropped significantly, is permanently eliminated as of 2025. It no longer exists. If you are currently paying more than $2,100 per year for your Medicare Part D covered drugs, something is wrong with your plan or your enrollment. Contact Medicare at 1-800-MEDICARE or visit medicare.gov to review your current plan. Number 3. Medicare Savings Programs, 4 types. Most seniors know none of them. Medicare Savings Programs are state-administered, federally funded programs that pay some or all of your Medicare costs. There are 4 types: Qualified Medicare Beneficiary, Specified Low-Income Medicare Beneficiary, Qualifying Individual, and Qualified Disabled and Working Individuals. Each covers a different combination of costs. The most comprehensive is the Qualified Medicare Beneficiary Program. It pays your Medicare Part A and Part B premiums, deductibles, and coinsurance. If you qualify for QMB, you are automatically enrolled in Extra Help for Part D. Your total Medicare cost exposure drops to near zero. The income limits for Medicare savings programs vary by state. In many states, the qualifying income is at or above the standard Social Security retirement benefit for a single person, meaning a significant proportion of Medicare beneficiaries may qualify without realizing it. Apply through your state's Medicaid office. The application is free. If you are unsure which program you may qualify for, call your State Health Insurance Assistance Program, SHIP, at no charge. SHIP counselors are trained specifically in Medicare benefits and have no financial interest in which program you choose. Their number is available at shiphelp.org. Number 4. Pharmaceutical Manufacturer Patient Assistance Programs. Every major pharmaceutical manufacturer in the United States operates a patient assistance program, a program that provides name-brand medications at no cost or dramatically reduced cost to patients who qualify based on income. These programs exist because pharmaceutical companies are required by federal law to offer their drugs at reduced prices in certain contexts, and because the reputational and legal risks of denying medication to patients who cannot afford it outweigh the cost of the program. They are not widely advertised. They are not automatically offered at the pharmacy. You have to ask. The eligibility criteria vary by manufacturer and by drug. In general, patients with income below 250% to 400% of the federal poverty level qualify. Some programs have no income limit and are based solely on lack of insurance coverage for the specific drug. NeedyMeds.org and RxAssist.org maintain free searchable databases of all manufacturer patient assistance programs, searchable by drug name. If you take a name-brand medication and pay more than $50 per month for it, check whether the manufacturer offers a patient assistance program. The application takes between 15 and 30 minutes and can reduce or eliminate that cost entirely. A patient in Ohio who was paying $420 per month for a brand-name blood pressure medication was connected to the manufacturer's patient assistance program through their pharmacist. Her monthly cost dropped to zero. She had been paying for 3 years before anyone mentioned the program existed. Number 5. State Pharmaceutical Assistance Programs. 37 states operate state pharmaceutical assistance programs, SPAPs, that provide additional drug coverage on top of Medicare for qualifying residents. These programs vary significantly by state in terms of what they cover, who qualifies, and how much assistance they provide. In New York, the EPIC program provides prescription drug coverage to residents 60 years and older with income below $75,000 for singles or $100,000 for couples. It covers the Part D deductible and coinsurance costs that Medicare does not pay. In Pennsylvania, the PACE and PACENet programs cover virtually all Medicare-approved prescription drugs for qualifying seniors with no monthly premium and minimal co-payments. In states without a dedicated SPAP, many seniors qualify for additional assistance through Medicaid, low-income home energy assistance, or county-level senior services programs that include prescription assistance components. To find out what your state offers, call your state health insurance assistance program or visit benefitscheckup.org. a service of the National Council on Aging that screens for over 2,000 benefit programs across all 50 states. The screening is free, takes approximately 10 minutes, and tells you every program you may qualify for based on your age, income, state of residence, and health conditions. BenefitsCheckup.org reports that the average senior who completes the screening finds over $900 per year in unclaimed benefits. For seniors with multiple chronic conditions and multiple medications, the figure is frequently higher. What to do today? Step 1. Go to ssa.gov/extrahelp and apply for extra help. If your income is below $22,000 per year as a single person or $30,000 as a couple, you are likely to qualify. Apply regardless of your expectation. Let Social Security decide. Step 2. Call your state health insurance assistance program. The number is at shiphelp.org. SHIP counselors are free, unbiased, and trained to find every Medicare benefit you are entitled to. This call typically takes 30 to 45 minutes and costs nothing. Step 3. Check needymeds.org for every name brand prescription you currently pay for. Look up each drug by name. If a manufacturer program exists, the application process is listed. Step 4. Visit benefitscheckup.org and complete the benefit screening. 10 minutes. Free. Covers every state and federal benefit program for seniors. Step 5. Call Medicare at 1-800-MEDICARE and ask whether your current Part D plan is still the best option, given the changes from the Inflation Reduction Act. Plans change annually. The plan that was right for you in 2023 may not be the most cost-effective option in 2026. The programs on this list are not charity. They are not difficult to access. They are part of a system you have paid into your entire working life. The reason most seniors are not receiving them is not eligibility. It is information. Now you have the information. Subscribe if this reached you. Every week we cover the programs that are available to American seniors and never get explained clearly.